Welcome, everybody. Thank you so much for joining us tonight for this wonderful broadcast of healthy holidays, keeping our kids mentally and physically healthy during the holiday season. My name is Michael Rouse, Executive Director and co-founder of ESF Summer Camps. I'm really excited about our guest speakers tonight. This webinar has been brought to you by Nemours Children's Health. And tonight, our topic, as I mentioned, is healthy holidays, keeping our kids mentally and physically healthy during the holiday season. Before we get started, just a few Zoom webinar protocols. You can see us, but we can't see you. All participants are on mute, so please place your questions in the Q&A box. We ask that you try to reserve your question until the end of the program. We will do our best to answer as many questions as we can in the time allotted. And for any questions we're unable to have our guest speakers respond to in that timely fashion, we will absolutely follow up with you with any outstanding questions you may have. And then finally, just a reminder that this is being recorded so that we can share it with all of our families at ESF that were unable to join us tonight, and so that you can reference it if you ever need it in the future. So let's get started. I think we can all agree that the holiday season is fun, exciting, memorable, but also can be hectic. Add in the colder weather, staying indoors, and more winter illnesses, it can be stressful. I know for the Rouse family, we have had RSV, we have had colds, we have had, you name it, we've had it in the last several weeks. And it's amazing. We think we get over the hump, and then sure enough, somebody else is sick. So we reached out to our great friends and experts at Nemours Children's Health, who is actually one of the largest integrated pediatric health systems in the country. And everything they do for medical care, research, education, prevention, and advocacy is focused on children. We want nothing but the very best for our ESF families, and we're proud and excited by this partnership with Nemours. Our Nemours experts will share tonight tips on managing the winter blues, keeping our kids active, avoiding winter illnesses, and dealing with anxiety that can come with a very hectic holiday season. I'm just going to give you a quick story about Nemours and how important it is to the Rouse family. We had a little girl who just turned 3, who was born 3 years ago. And we had some complications and had to spend some time at CHOP for about 2 months. And then we heard about Nemours, and we went down to Nemours and spent about 2 months at Nemours, and have gotten to know pretty much every nurse and every pediatrician and great expert doctor down there. And I have just been so impressed with the level of care and empathy, as well as expertise that they have. So when this opportunity with Nemours came about with the partnership with ESF, I couldn't have been more happier to be able to say we know surely who this Nemours group is. And so I couldn't be more excited to be introducing to you 2 true subject matter experts this evening from Nemours. Dr. Chrissy Cammarata is a board-certified psychologist at Nemours Health and Clinical Associate Professor of Pediatrics at the Sidney Kimmel Medical College, Thomas Jefferson University. Dr. Cammarata is the clinical director for the Child and Community Outpatient Psychology Program and lead psychologist for the Eating Disorders Program. She trains externs, residents and fellows to implement evidence-based practices. Doctor has also authorized several book chapters in the areas of diabetes, treatment, and assessment of eating disorders, and adjustments to hospitalization. Our second expert tonight is Dr. Michael Harkness, is a general pediatrician for Nemours Children's Health in Paoli. He has been practicing pediatrics in the Philadelphia area for over 30 years. Dr. Harkness was born in Philadelphia and went to medical school at the University of Pittsburgh School of Medicine. His specific interest in general pediatrics practice includes sports medicine and the care of children with ADD and asthma. He most enjoys watching patients grow from infants to adolescents to now young parents. I'll turn the program over to them, and then we'll have some time at the end for questions that you may have. So please put your questions in the Q&A box, and we're going to begin with Dr. Cammarata. Welcome, Dr. Cammarata.
Thank you. I'm excited to be here tonight. Stephanie, will you show the slides? I'm sorry, folks. I'm on my phone tonight, so I can see. Well, I've got the PowerPoint in front of me. I'm just going to go. So I'm here to talk to you tonight about managing holiday stress and stress during school breaks. And as next slide, you can see we have our friend Llama Llama, who, if you have young kids, I'm sure you've read this book, Llama Llama Holodrama. And we know that when there's any kind of change, that this can cause stress on our bodies, and we can especially see that stress exhibited by young kids. And this is, we think of stress as something that it comes about when something bad or negative in our life happens, but we forget that seeing friends and going to parties and baking cookies when we should be going to school, all of those kinds of things can impact us and our kids. So I'm going to talk today a little bit about some things that can help us sort of stay on that even keel and keep that stress at bay during those breaks. Next slide. So one thing that can be helpful for parents to do is communicating plans with their kids. Sorry, give me just 1 second. I need to make my computer a little bit bigger. For older kids, you can use a calendar to communicate what kinds of things that they can be expecting. For little kids, you want to obviously make things a little bit more visual. You can use social stories, read lots of books, but essentially you want to give kids a heads up about what's going to happen. And the longer you can sort of take to prepare them, the better they're going to do. The more time anxious kids have to prepare, the less likely it is that they're going to be anxious and they can kind of come to terms with things. And so then the less you're going to see outbursts and overstimulation and things like that. Next slide. Try to keep routines as much as possible. Obviously, we're talking about a big change in the routine when your kids aren't going to school, you're not going to work, you might be traveling. But as much as possible, if you can sort of bring those comforts of home to whatever you're doing, the better. So kids obviously respond well to planned, predictable days. That's why we talk so much about trying to have sleep routines and meal schedules and things like that. So even during the holidays, try to keep that up. Keep your sleep and wake schedules the same as much as possible. Even if you're traveling, even if you're at friend's house, try to get those kids naps, try to get them to bed. Make sure you're having meals, take baths, bring books and things like that they're familiar with. And again, if there's going to be a change in one of those schedules, try to let your child know. Next slide. And obviously, though, we're expecting that there's going to be a lot of changes, so expect them. Plan ahead, try to bring things with you, try to prepare your kids, try to let your family members know when things are going to be sort of outside of your comfort zone, so that if your child is not having their best day, if you're not having your best day, that everyone is prepared and everyone can be supportive. Next slide. So set aside some special time. This is a really important tip that I tell a lot of my families. Whenever anything stressful is going on, holiday changes, anything, try to set aside some quiet one-on time with your child each day over the break or over the vacation or whatever it is that you're doing. For young kids, you probably only need as little as 5 minutes a day. For other older kids, school age kids, teens, 10 to 15 minutes. You may need a little bit longer as kids get older and your focus is more on conversation. But for little ones, try to have 5 minutes. Let them choose what you do. Let them take the lead. Let them decide what to talk about. Don't have this be a corrective time. Let it be something where you focus on the things that you love about them, the things that they're doing well. You can think about using the acronym PRIDE. This is something that one of our evidence-supported parenting interventions, parent-child interaction therapy, uses, and it applies not just for young kids, but also for older kids. So the P stands for praise. Talk to your child specifically about the things that you love about them or the things that they're doing well. Reflect on what they say. So when they say, wow, I had a test today at school and that was really stressful, kind of like holding a mirror up back to them. You had a test today and it was really stressful. Then you can say, tell me more about that. And they may not, but at least they know that you're hearing them because you're saying back the words that they're saying to you. Imitate their play or kind of follow along with what they're doing. If it's an older kiddo, let them lead the conversation. Describe their actions. So if you have a younger kid and you're playing Legos, you're putting the blue block on top of the red block, kind of saying what you see them doing. You're coloring with the blue crayon. These are things that really just help kids know they have your attention. And then finally, the E stands for enjoy or enthusiasm. Show them how much you love playing with them or talking with them. Show it with your smiles, show it with positive touch. All of those things, again, it's going to fill their bank up that they have with that need for attention. And what it's going to do is it's going to help them be able to sustain, stay in an appropriate stimulation zone when you're, looking at holiday lights and there's a lot of noise and a lot of people around. Next slide. So the next tip I have is to set realistic expectations. And this is, goes for you and your kids as well. Cut yourself some slack, cut your kids some slack. It's a stressful time. Everyone is expected to do all of the things. So, kids are going to have bigger emotions and they're going to act out. You're going to have bigger emotions and act out. If you have a child that has any disruptive behavior disorders or something like ADHD, they're going to be more active. They're going to be more disorganized. Kids are going to have more issues. If you have a kid that's autistic, those kids may need a plan for how to manage overstimulation or understimulation. Introverted kids are probably not going to rise up and want to spend time with all of their relatives that they never see. Be prepared for that and kind of have a game plan for your kid. Don't expect them to become a social butterfly overnight. If you have a kid that's managing an eating disorder or a feeding disorder, have a plan for what to do when there's new food, when you're at a place where there's a lot of people around and that kid's already going to be on edge. How are you going to manage that meal? If a family member says something that's triggering, how are you going to manage that conversation? How are you going to protect your kiddo? So just plan ahead and also realize these things are going to happen. It's not going to make or break your life or your child's life, but the more you can be communicating and expecting, the better you and your kiddo is going to do. And remember, everyone's having bigger feelings and have less patience. You're human. That's okay. Next slide. Set some boundaries. So I think plan ahead and know that you can't do all of the things. You're not going to be able to go to all of the light shows. You're not going to be able to go to every family member's house. Respect your own limits. It's okay to say no. It's okay to leave early if that's what you need, if that's what your kiddo needs. Make sure that you feel comfortable communicating to your family, your friends, whoever you're trying to see at this time of year, and let them know, you have to prioritize what's important to you and your kiddo. Next slide. Be mindful. So one of the best ways to sort of manage all of this stress is to sort of drop into your moment and be aware of what's happening and sort of accepting that stress is happening. And okay, let's figure out a way to manage this. So notice when that fight or flight is kicking in. And I often talk with families to put your hand on your heart and sort of feel your heart beating and feel your breath, connect with your body in that moment. And you can encourage your kiddos to do that too. Kids are very receptive to some guidance along this. So just kind of stop and drop into your body. Describe what sensations you're noticing. Are you noticing, that you're feeling kind of like a buzz happening in your body? Are you feeling your heart beat faster? Label the emotion that you're experiencing. Is it anxiety? Is there fear? Is there anger coming up? Just put a label to that. A lot of times that has a nice way of acknowledging what's going on and allows that emotion to sort of diffuse a little easier. Notice and pay attention to your breath. Schedule time for yourself if you can. Everyone is doing all the things again. And if you can take 5 minutes, if you can pass the baton to your partner, if you have one, but take a time out when you need to. And you can also model this for your kids that, I'm feeling really stressed. Everybody's really loud. I know we're having a great time. Mommy or daddy or whoever is feeling like I'm feeling stressed. I'm going to go to the bathroom for a few minutes and be okay with that. And modeling that for your kids allows them to feel okay with it as well. Next slide. And the last thing that I want to just talk about is things to watch out for, because this is a hard time of year for adults, for kids. Some kids have a hard time because they're not having that routine of going in and seeing their friends and getting out of bed. And so kids who are prone to depression, this might be a time that things can be stressful for them. Kids who have difficulties with eating, when they have things sort of uprooted, they're going to struggle with that more. If you see your kid withdrawing or staying in their room, refusing to come out, sleeping more or not sleeping at all, those are kinds of things to be mindful of and get your red flags up. Not eating, if they're complaining about headaches and stomach aches. A lot of kids with anxiety complain about those things. If this is something that's new or you're finding that it's happening more frequently or at greater intensity, something to keep in mind. And any violent or aggressive outbursts, again, something that's out of the ordinary for your child. These are things that you may want to reach out to a mental health professional or contact your pediatrician, just to say, hey, I'm concerned about some things. I'd like a checkup and to see if there's anything that we need to do next. I hope that you all have a lovely holiday, and I'll look forward to your questions.
Doctor, thank you so much. The pride drill to do with your child was really powerful, especially for me with 4 children. And was curious if you could just tell us a little bit more about the imitate the I and the D, because I think that you went through that very quickly, and I think that was really a powerful moment that could help us kind of slow down to get to know our children in that moment. Would you mind just repeating that again, the I and the D part?
Or yeah, absolutely. And
one?
Your point, oh, sorry. Your point is exactly right. The I and the D are really good for kind of helping us connect in that moment. So if you think about with little kids, the imitate sort of helps you know how to play with a young child, because a lot of us don't. You have your 3 or 4 or 5-year-old sitting in front of you and you're like, I don't know what to do next. So if you imitate what they're doing, it helps them stay in the lead of the play, and they know that you value what they're doing. So if you have a little guy who's playing with cars, you pick up a car too and drive it around. If you have someone else who's coloring, you pick up and say, I'm going to color with the red crayon just like you. So using that verbalization of I'm doing what you're doing, and they can see that you're doing the same activity as them. Again, if you have an older teen that likes to play video games, you can jump in with video games. That's a way to imitate. And you can kind of adapt this for the developmental age of your kid. But essentially, do what they're doing. Let them know you enjoy it. Let them see you kind of copying what they're doing. And then the D is for describe. So this is a really powerful behavior, and it feels super awkward at first when I'm teaching parents to use this, but it's a great way, again, for parents to stay behind the kiddo in terms of what you're doing. And it has a really powerful effect of helping with attention. So kids are kind of all over the place. And if you have a kiddo with ADHD or have, any kind of memory or attention issues, it's hard to follow them, and they often find they can't follow themselves a lot of the time. And so by describing what they're doing, it kind of helps develop that internal monologue that we all kind of use to keep ourselves on track. So an example of this might be, if a child is coloring with a red crayon, you're coloring with a red crayon. Oh, you're putting the Barbie in the house, or you're taking the blue car and you're driving it up the ramp. Oh, you're driving the car down the ramp. Oh, now you're lining the cars up. You're driving those cars really fast. So one thing I'm doing is I'm making sure to say you are, and then I'm using an action word. So I'm not talking about, oh, those blocks are blue, that house is nice. I'm saying you are doing. And this really helps kids get a sense of like, oh, my parent or caregiver is really paying attention to me, and it connects them with their actions.
Great. Thank you so much. Really appreciate it. We have another question, and that is, my child is struggling with kind of listening to his teacher. Do you have any tips when it comes to honoring authority?
I guess I would have a question on, is it just with teachers or at home? Because I think there's a couple of different ways I might handle that. If it's with a lot of kids who are having troubles just sort of listening to any adult caregiver, there's sort of 2 things that I approach and talk with families about. The first is just what we talked about, those pride skills. You need to set aside time where that kid gets to be the boss. And so it's really important to make sure that you're doing some of that every day, where they're not being bossed around. You're not telling them what to do. You're letting them sort of be the guy who's in charge and get that need met that a lot of our kiddos have. And then the second part of that is then really practicing giving commands in a really effective way. So being very clear, rather than saying, hey, how about you go clean your room? How about you do your homework? You say something like, please take your shoes upstairs. And then the next part of that piece is having an effective consequence after that. So if the child does take the shoes upstairs, hey, great job listening. I really love when you did that the first time. That was really awesome. If they don't, for a younger kid, we'll often implement something like a timeout. Or if you have an older kid or a kid that has kind of more kind of general behavior concerns like we see in ADHD, we might set up a token economy system. So it's more like positive based, where we're going to give a token every time they do something right the first time, and they might not get that token if they don't listen the first time. And so then sometimes that will generalize to school. We can also talk to teachers about implementing a similar sort of token economy for listening, being responsible, and things like that in the classroom.
Great. Thank you very much.
Yeah.
Okay, why don't we introduce Dr. Harkness?
Thank you very much. And thank you, Dr. Cammarata. If you don't mind, I'm going to steal a lot of what you said for my practice because it was actually really good. So
Please do.
Thanks very much. And thanks very much for joining us here. I want to talk to you a little bit of winter challenges, and I've tried to make it kind of timely. If we could have the next slide. I wanted to talk about winter illnesses, as well as keeping kids active, and as well as some safety tips for children during the holidays as well. Next slide. With winter illnesses, of course, what's on everybody's mind now is upper respiratory infections. With words like RSV and COVID and flu are kind of dancing around all over the place. And so I wanted to kind of go over some of those. Most of the winter illnesses, and the ones we're going to talk mostly about, are respiratory illnesses. So the common cold is still very much out there, as well as flu and RSV and COVID. And I will spend some time on some other illnesses as well. Next slide. So when you talk about all of these respiratory illnesses, the COVID, the flu, the RSV, they all do basically the same thing. The virus goes in and infects cells in the respiratory tract, from the tip of the nose all the way down into the lungs. It causes swelling of the lining of the respiratory tract. So the way that your nose gets swollen and the back of your throat feels swollen, well, the lining of the lungs get a little swollen as well. And all of those mucous membranes, we call them, make mucus. They make extra mucus, which is why you have so much mucus that happens in those areas, in the nose, in the back of the throat, and even up in the lungs. And it also irritates the upper part of the airway, which causes cough. The cough mechanism in people is set very finely, because that's the way you keep from choking every time you eat. Anything that goes into the upper part of the airway, the body tries to cough that out. So when you get an irritation in the upper part of the airway, the body doesn't know whether it's an irritation or whether it's a piece of hard candy coming down there. So it's going to try and cough and get rid of it. So the cough mechanism is very sensitive, and it's very hard to control. Next slide. So basically, they all present the same way. So although you talk about RSV and COVID and everything, all of these illnesses basically present the same way. They all present with congestion and runny nose. They all present with cough, which can literally last several weeks. That's not a typo, that's several weeks. They all can give you sore throat. They all can give you fevers of various degrees. They all give you some decreased appetite. They all give you some malaise, which is just the fancy medical term for the blahs. You just kind of feel rotten. And they all can give you secondary infections, ear infections, sinus infections, pneumonia. They can all do that. So how are they different? Well, let's start, next slide, with RSV. Everybody's talking about RSV now. The RSV is something that we've been dealing with forever. I've been dealing with RSV for the last 40 years in practice. And RSV is a virus. It's called respiratory syncytial virus. And it's a virus that used to have a lot of significance just for kids under the age of 2 years, and especially just under the age of 6 months. This virus tends to get a little bit deeper into the lungs. So it tends to get down into the lower airways and cause some increased swelling in the lower airways. And that leads to wheezing. The same wheezing that you hear if your child has asthma, that same area of the lungs is what's affected with RSV. So these are kids that will actually have wheezing, and wheezing is a whistling sound when they breathe out. So you're going to hear them breathe in normally, but you'll hear them going, I hope you can hear that, but that's a whistling when they breathe out. It's like taking a little balloon and blowing it up, and you hold the end and it whistles as the air comes out. This is millions of little microscopic balloons in the lungs that are filling up, and then because there's swelling down there, they're giving you a wheezing sound as you breathe out. Now, RSV is something that everybody can get. We usually don't think much about it because most people over the age of 2 don't get it particularly bad, have a particularly difficult time with it. But kids under 2 often wheeze with it, and kids under 6 months can have a really tough time, as well as kids who are premature or have severe cardiac problems. If your child's had a surgical correction of a cardiac disease, they're at particularly high risk for RSV. But again, in the older kids, it's usually not a big thing. The real difference is that before COVID, this was something we only saw in January and February. And since last year, we've been seeing it since April, and we saw it right through the summer, which is just shocking for us. We never saw it this late in the year. But it's out there. So not a particularly bad thing for most kids, but if you have a kid under 2 who's wheezing a lot, or you have a kid under 6 months, you want to be a little more careful and check in with your pediatrician. Next slide. The other ways that are different, flu, we always talk about, and everybody kind of talks pretty flippantly about, oh, it's just a flu, it's just a flu. Flu is actually a really nasty disease. Normally, when you have influenza, which is the flu, you can have a very high fever. We have 13 and 14-year-olds who have fevers up to 104. They often cause symptoms outside the respiratory tract. So if your child is older and has a fever and has a headache and has abdominal pain, and especially leg pain, these kids often have pain in the backs of the calves. They'll get up in the morning with a fever and say, I can't walk because my backs of my legs hurt so bad. That's almost always flu. So the muscle aches and the headaches and the belly aches are often flu. And flu can be really severe, again, especially in kids under 6 months, but also really severe in older people. So around the holidays, if you're going to be around people, especially older people, and you think your kids might have the flu, you want to keep them away. Now, COVID obviously is the new one. And as all of you probably know, this can vary between having no symptoms at all to being really, really severe. So we have to be careful with COVID. The only thing that distinguishes COVID from other illnesses is that sometimes you can get a loss of taste or smell. That happened a lot with the earlier variants. The Omicron variants really don't give that very often. But if you do see a cold with a loss of taste or smell, think about COVID. And COVID is the only one so far that we know can give some kids some long-term symptoms. So when you get the flu and you're done, you're done. COVID, we do see some older kids who get fatigue and get some brain fog and things. So there's the differences. So how do we treat them? Basically, you treat them all the same. You try and keep the airway moist so that the mucus stays nice and loose and stays easy to bring up. So vaporizer, humidifier, lots of clear fluids. A lot of kids in my practice love it when they're 4 and 5 and 6, and I say, you're going to have to eat popsicles. You're going to have to eat lots and lots and lots of popsicles. And I make it sound serious, and they smile at me like that's the best thing I've ever heard. So popsicles, chicken soup, water ice, anything that they enjoy, you want to get as much fluid into them because that's going to really help with their keeping the mucus moist. Excuse me. I do use Vicks Vapor Rub. I don't have any financial ties to Vicks, but it has been shown to help some for kids older than 1. I don't use it in kids under 1. The kids under 1, it sometimes can make things worse, but older than 1, you can put a little dab of Vicks on the chest. We've had a lot of people lately who put Vicks on the feet. I'm not sure where that rumor kind of got started, but really Vicks in the bedroom is going to be fine. Anything that has that vapor is fine, but just a little teeny bit on the chest, and keep Vicks out of the way of children. It can be very toxic because it's ingested. So just a little teeny bit on the chest is enough to give you those vapors. For cough, I use honey. For kids older than 1, I use cough drops for kids older than 4. If they're sitting down, it makes it less of a choking hazard. But I love doing local stuff for cough, like the honey and the cough drops. Next slide. For infants under a year, you can use the saline nose drops and the suction. I know how much everybody hates doing the suction, but the fact is, babies under 1 have to breathe through their nose. They can't get more than about 30% of their air through the mouth. So if their nose gets plugged, they really have trouble breathing. And a nice, gentle, deeper suction will really help them out a lot. You don't want to do it too often to create irritation in the airways in the nose, but you do want to use the suction whenever you can. For fevers and achiness and chills and things, you can use acetaminophen or ibuprofen, which is Tylenol and Advil and Motrin. They do not help a stuffy nose or congestion. So if your child has a little stuffy nose and he's congested and he's coughing and he doesn't have a fever and he's not achy, Tylenol is not going to help you. Ibuprofen is not going to help you. There are some specific treatments for flu and COVID, so the Tamiflu and the Zofluza and all. And of course, the vaccines for flu and COVID, they're both really good. They're really helpful, and we've seen very few side effects with the COVID vaccine. So even down to 6 months, kids can get vaccinated. It doesn't completely prevent the disease, but it does keep them from getting really, really sick with it. So what doesn't work? Antibiotics don't work. Sorry, I know everybody calls to say, can I just get amoxicillin to kick it? The fact is, no, it doesn't kick it. And number two, you can't find amoxicillin now anyway. There's a countrywide shortage. So we're struggling to figure out what to use when kids do need antibiotics. I don't use cough medicines. Cough medicines tend not to work either. So all those things, all the Mucinex and the Delsum, I don't find that they really help very much. I like the honey and the popsicles and all that just as much. And I don't use antihistamines. Allergies will have the same runny nose and congestion and cough, but it's a different pathway that gives you that runny nose. So an antihistamine like Claritin or Zyrtec or Allegra is not going to help you with a cold. In fact, that's how we tell when somebody has an allergy versus a cold. We'll say, let's try a couple doses of Claritin, and if it makes them better, they've got an allergy. If it doesn't, it's probably a cold. Next slide. Okay, when to call if there's respiratory distress. So if there's trouble feeding, if there's nostrils flaring in infants, if they're retracting, the skin sucking in between the ribs. In older children, if they're struggling to breathe or having retractions, we need to see them. So give us a call. Vomiting and difficulty getting fluids in, ear pain, fever that goes away and then comes back. All those things are at least worth a phone call. Other than that, if it's been 2 or 3 days and they have cough and congestion, a little sore throat, we really is nothing that we need to do. You're welcome to call in and check in with us, but you don't need to worry about getting an appointment or running them to an emergency room. This is just a virus, and it's just going to have to run its course, which should be fine. Other will illness, I just want to touch real quickly. We do see some vomiting and diarrhea in the winter time, more common in the summer, but we do see some. If your children start vomiting, just a couple of really quick tips. One, first of all, hold off on giving them any food or fluids for about 30 to 60 minutes after they throw up. And when you do offer them fluids, just offer about a tablespoon at a time and not water. Water, actually, everybody wants to give water or ice chips, and that actually sits in the stomach for a long time. You're much better to give something like diluted Gatorade or Pedialyte or something like that. And again, I have no financial relationships with any of these groups. But anything that has salts or sugars in it will actually get absorbed quicker and will actually be better. And then once they've had a couple of tablespoons and they're doing better, then you can advance them to more and more clear fluids and advance them up to bland, starchy foods. Next slide. Lastly, we're seeing lots of kids coming in with eczema. Once the air gets cold, the humidity drops and all these kids get dry skin. So go to the pharmacy or go to the grocery store and find a nice big tub of whatever moisturizer you like that doesn't make you too greasy. I have my favorites, but I'm not advertising any one of them. But get a big tub, and when your kids get up in the morning, slather them with a big handful of moisturizer, put the clothes on and shove them out the door. At nighttime, get them out of the tub, dry them off, slather them with the moisturizer. It really helps if they can get moisturizer all over. It really helps the dry, itchy skin. And you will see a lot of viral rashes in the winter, and that tends to scare everybody. They're almost always completely benign, and there's nothing you have to do. In fact, a lot of times the rashes tell you that the virus is going away and you don't need to do anything. So, all right, next slide. We'll go through quickly how to keep kids active during the winter. Don't be afraid of the cold. I hate the cold myself, but I still will get out and bundle myself up and walk around the neighborhood or walk on the track somewhere. So just don't be afraid. The kids don't mind the cold. Dress them up with hats and mittens and scarves, put on the waterproof clothes, put on boots, and let them get out and play, especially in the snow. Let them get out there and do snowmen and snow forts and all that. There's nothing as a kid like going out and building a snowman and getting your nose all frozen and then coming in and having a hot cocoa and a grilled cheese sandwich. That's kind of the way childhood should be. So get them out there in the snow, get them outside. I use some apps like AllTrails to find places to go hike and explore. That can offer me a lot of fun in the wintertime, because when there's less things growing, there's more rocks and things to turn over and explore, and kids just love that. Next slide. And also you can find some indoor fun. I mean, a lot of times you can find swim clubs that'll let kids go swimming in the summer or in the winter. You'll sometimes have gyms. Sometimes churches and schools will have gyms that they'll allow kids to play basketball and things. Take walks around the mall, get scavenger hunts in the mall. You just can't go to the mall and go from like Annie's to Orange Julius to, you can't go from junk food to junk food to junk food. Just walk around the mall and stay active, and just try to keep them moving. And then lastly, I know I'm a little over time, but I'm going to go quick here. Next slide. Okay, keeping kids safe. So when they're out playing, they are going to get a little colder. They are going to get more tired. So take frequent breaks. Try to keep the clothes as dry as you can, especially hands and feet. So glove liners, layered socks, all that will help. Be careful with streets. Remember, cars can lose traction and slide. Sledding, you want to stay in open areas. So I know when I was a kid, we used to sled in the street. I don't know how we lived through it, but be careful. There's plenty of parks around where they can sled. And skiing and snowboarding, they really should have helmets. Everybody kind of fusses about them, but they're really important to prevent head injury. And lastly, holidays. Keep track of the fact that plants are really kind of poisonous for both kids and pets. So poinsettias and mistletoe and holly berries are nice to look at. Keep them away from your younger kids. Toys, always buy age appropriate toys. Watch for small parts. The toilet paper rule is anything that can fit down the inside of a toilet paper roll can fit inside your child's trachea. So if it can slide down there, don't give it to a 3-year-old or a 2-year-old that's going to mouth everything. Be very careful with button batteries and with strong magnets, those little toys with the really powerful magnets that stick together. Those things are awful for kids. If they swallow them, they can stick together in different parts of the intestine and cause rapid destruction of a lot of the intestinal tract. So fireplaces, remember, we don't put fireplaces in pillows. We put them in big stony areas with lots of edges and lots of hard stone. So be careful with the fires and the surrounding stone. And just be careful with fires. Make sure you've got your smoke detectors, your fire extinguishers, keep your trees well watered, and keep the candles up high. Those are all some of the biggest things that you have to be careful with. So again, sorry I went over time, but I'm happy to answer any questions.
Thank you, Doctor. Appreciate it. We have a few questions coming in right now. The first one will go to Dr. Cammarata. Doctor, can you share ideas on tips to get a 12-year-old child out of his room to spend more time with the family?
Yeah, what a great question, and a very common one, I'm sure. I think that at around this age, we do see a lot of kids sort of spending more time and wanting more privacy in their bedrooms. And so so much of that is just developmentally appropriate. As a parent, what I would say is try to think about what the function might be. So it might be that this kid is just trying to explore his own or her own personal space. But sometimes kids are retreating into their room because of things like depression, or they're having a hard time. They're feeling overstimulated in the home, or you have guests around or something like that. So I think part of it is thinking through how can we make the space more inviting and feel more comfortable to a kid who's maybe having a hard time. And then I think just kind of going back to some basic sort of parenting rules, try to invite him to do things that he might already want to do. So thinking through the things that he likes to do and try to have that be something that happens. Watch Guardians of the Galaxy as a family and see if he wants to join in on that. Let him play video games if he likes to in the living room. We don't want to do a ton of screen time, but I think those kinds of things that kiddos already like to do, if that can be what's happening, they may be more likely to come out. And then I think, if you're able to enter his space and that's something he's comfortable with, you have that relationship, spend some time with him in there, just kind of check in, pop down on the bed, make some comments, tell him some things about what happened to your day. You can ask some questions and see if he responds. But I think the key is try to connect, even if that child is not necessarily coming out and wanting to connect in the big family space. Text messaging, talk to him during car rides, try to be creative in how you connect, even if, this is a time when he's spending a lot of time more isolated. Be there for him and be a consistent presence.
Great. Thank you so much. Dr. Harkness, we have 2 questions for you. Manuka honey has been in the press a lot. People are talking, and the question is, we're getting ready to travel both in car on a road trip and then eventually on a plane. We have been told that Manuka honey builds up the immune system. What do you recommend?
I recommend being really careful about finding out medical information on the newspaper. because a lot of times they get passed around and passed around. And when you hear it enough times, you think, geez, it must be true. I have kind of the same problem with elderberry. And the thing with elderberry and manuka honey and all of that is that it certainly doesn't hurt, and you're welcome to do it, and that's fine to do. There's not a whole lot of evidence for either of those in terms of building immunity. Building up immunity, kids have really good immunity. The problem with kids when they get lots of colds and things is not that they don't have the immunity, it's that they have the exposure. So if they're going to get colds, they tend to get over them pretty well. If you're going to have a problem with your immune system, you don't get over the colds. If you get over the cold and then the next week you get another cold at school or another cold at daycare, that's not an immunity problem. That's an exposure problem. So I like to tell people, if you sit on wet paint and you get up and say, oh my gosh, and you change your clothes and you go back and sit on wet paint again, it's not the paint's problem. It's the fact that you're getting exposed over and over and over again. But I don't have a problem with trying honey. I don't have a problem with trying elderberry. I do have, I've had people ask me about vitamins. I'm not a big vitamin fan in tablet form. I like kids to get them through their foods. But I'm okay with a chewable vitamin. And a lot of people recommend extra vitamin D during the winter time. And I think that's actually okay because we don't spend as much time outside as we do in the summertime. So I think it is not a bad idea to do a little extra vitamin D, especially on days when you're not outside a lot. But other types of honey and thing, I think you have to be careful. I mean, it's fine to do, but again, make sure that it's really coming from a source that has some data behind it.
Great, thank you. Our next question for you, Dr. Harkness, is lately when my child develops congestion, she also gets really goopy eyes, according to the parent. How can I tell if it's another viral symptom or if it's a secondary infection of pink eye?
Okay. The most important thing with pink eye is you should have some redness of the white of the eyes. So when you have a cold, you'll often have a little bit of congestion. You'll often have a little bit of running in the eyes. You might even have a little bit of crustiness in the eyes. And that's all part of the virus. Pink eye can be caused by 4 things. It can be caused by viruses. It can be caused by bacteria. It can be caused by allergies. And it can be caused by contact. So contact with things, if you go swimming in the summer without your goggles and you open your eyes and your eyes get red, that's pink eye. That's conjunctivitis from contact. The allergy ones tend to be a little bit more stringy and mucousy and not red. Bacterial and viral tend to be red. And the viral ones tend to be kind of a clear discharge, and the bacteria tends to be a really pussy, thick, kind of nasty discharge. If you're not sure, check with your pediatrician. Sometimes we'll do drops for kids if they have bacterial pink eye. The way to tell whether the pink eye is bacterial and needs to be treated, you also have to think about what other symptoms do you have. So if your child's had a cold for a couple of days and then ends up developing thick, goopy eyes, redness in the eyes, happens to get a new fever, especially if they're kind of, complaining about their ears. Goopy eyes and goopy ears often go together. So if you're seeing that together, that's often a sign of a secondary infection. And that's something you should check with your pediatrician about.
Great, thank you, doctor. I want to thank everybody again for joining us this evening. We've had 2 exceptional guests, Dr. Cammarata and Dr. Harkness. Thank you for your time. We hope that you found this webinar, families, to be very helpful and informative. As you know, we did record this event and it will be available on our website. Please stay in touch and keep an eye out for our next webinar. If you have any follow-up questions from tonight's expert guests, please reach out to us at info@esfcamps.com. Or for additional resources, please log on to the nemours.org website or www.kidshealth.org. In the meantime, please enjoy these last few weeks with the holidays, and we're wishing you and your children a very happy, healthy, and joyous holiday season. Thank you again for joining us tonight, and good evening.